I am a proud acute lymphoblastic leukemia survivor, and I have had many secondary associated medical issues that are quite rare. My story is one thing, but to see people who have sarcomas and who have lost limbs, people who have brain neoplasms, people who are at the end of their life and there aren't enough medications yet that can save their lives, those are the true inspirational stories.
I became an advocate for better lymphedema treatment because my son Dylan was born with primary congenital lymphedema. I just saw this huge need there, and part of me was angry that nobody had fixed this problem and now it was my child's. As I looked into it further, there'd been people complaining about it for a very long time, and as people do, saying somebody should fix this problem. And I felt like if I didn't decide that that was me, it was my child's problem. It's enough to be born with an incurable disease and have coverage for your treatment items. You shouldn't have to fight for those items on top of that. So I couldn't cure him, but I could make it easier for him to live with by getting the coverage for the items that he needed to have.
If we, the patient community, aren't engaged as advocates for our disease, they wouldn't get the hearing that they deserve on Capitol Hill or in Bethesda where the NIH is headquartered, or with any of the drug companies or research facilities anywhere in the United States. We've increased the federal research money dedicated to pulmonary fibrosis by $106.1 million. Funding that had been flat for the prior 10 years has taken a substantial leap. The number of grants, research grants, has also doubled from 68 to 136. If I was in the White House, I would flip the defense budget and the NIH budget. If you're a rare disease patient, you have a pretty compelling story to tell. Get out there and put into words how your disease affects your life and how important it is to find a treatment and or cure for whatever your issue is.
Patients with rare disease have pre-existing qualifications. We have that first-hand experience that is second to none. In order to make change, I need to step forward. It is Congress's job to help us, and we should not feel intimidated when it is critical. Our lives and livelihood are at stake.